Hi everyone, this is Dr. Raquel Butler from Integrated Veterinary Therapeutics.
And Sophie Vandenberg from Equine Postulate. And we welcome you to the Equine Functional Posture Podcast, your ultimate source for insights into the influence of functional posture on biomechanics, health, and overall well-being of horses.
Whether you're a seasoned equestrian, an equine professional, or simply a horse enthusiast, this podcast is designed to help you understand the critical aspects of functional posture.
Tune in each week as we discuss practical tips, delve into expert interviews, and explore the latest research in the impact of functional posture on equine anatomy, physiology, movement, and more.
Let's create a world where we empower our horses to be in a mental, emotional, and physical balance. Hi everyone, welcome to today's episode. We're actually going to spend the next couple of episodes talking about head shaking. So in this one, we're going to talk about the signs of head shaking and the causes, and then in part 2 we're going to discuss the diagnostic options and treatment options. And I thought it'd be a good opportunity to do this podcast because the season is changing here in Australia at the moment, and so there's a few horses that are starting to show some signs. So how are you going today, Soph?
Hi, Raquel. I'm going really well. This is a topic that you have done a presentation on before that a lot of people resonated with because they had frustrations about experiences they've had, and it's often a confusing or very frustrating disorder, especially the idiopathic or the seasonal things. And yeah, so it's just going to be something that's very useful for people, whether you are affected by head shaking with your horse or not, because the topics are still relevant.
Yeah, and also if you can pick it up early, like I had a head shaker about 20 years ago now. And when I looked back, the signs started pretty early. So he was an off the track thoroughbred. And I thought the resistance initially was just him not understanding the training, like he just didn't understand the bit coming off the track, and he would just have this bit of resistance where he'd kind of throw his head up a little bit. And yeah, I put it down to other things, and it took probably about 12 months, and I, took him up into higher level work pretty quickly. So, he went from off the track up to doing like half pass, and we were working on flying changes and things like that. And he got worse when I moved him to a specific area which had a really enclosed hedge around the whole property. And he was so bad that he would throw his legs at his nose, he'd whack me in the head. And, back then I was not very smart, so, I kept working him. And I had people treat him, but nothing was really helping. And that really sent me on a journey about head shaking. And in the end, I had to sell him because I went overseas and I had the head shaking under control. But unfortunately, after I sold him, he was such a good horse, and the person who bought him competed him pretty quickly up to over a meter jumping, and the head shaking then came back, and she spent double what she paid for him because he was just such a lovely horse. And she went through all the veterinary diagnostics, and in the end, he was basically retired as a trail riding horse. And it was really disappointing because then I learnt more as I became like more into the body work, and found out about a lot more therapy options, and I wish that I'd known about them back then because it could have been a different outcome for him. And I can see also now when I look back at his posture and photos that I have of him, I can see how his body set him up for that as well, like the tension patterns in his body and how they set him up for that. So yeah, there's a bit of a personal thing with the head shaking aspect of it because it was so frustrating.
Absolutely. And I suppose, there's so many times you look back and you realize there were things going on. I mean, myself, I just in watching videos of a horse that I used to have a few years ago when he had an injury in the paddock and he capped his hip, I didn't even put two and two together until recently watching videos. He was showing head shaking signs as well, like ticking through the mouth, a lot of mouth tension when things flared up for him, or if he, had gone for a bit of a play or, raced around when he was meant to not be doing that during a rehab period. And it's just one of those things that, it pops up and one day you have a realization about it. But definitely seeing signs early and being able to recognize whether something's going on with your horse, which is what we're going to discuss, is very valuable. What would you say depicts, head shaking, if you were going to describe what you're seeing?
Yeah, initially it can be like what you said, just little kind of vertical ticks. And that can be the start of it. Like that was kind of the start of it with Jack, my horse, and with a few other horses that I know. But sometimes it can be a really sudden onset. I've also treated a couple of horses where there was just a sudden onset of head shaking, and I'll talk about why that was the case for those horses. But it's often a vertical movement. And generally it's not just a horse like shaking its head. You know how it's a horizontal shake when a horse just shakes its head. You can sometimes get that, but it's usually an acute irritation with that sort of shaking. And it's usually something that you should be able to find the trigger of it fairly quickly. Whereas what we're classifying as head shaking is that vertical, sometimes there's a rotary action to it. Often it can be quite jerky. It's not controlled. And if you stand too close, you will get whacked in your own head because they're not. And that's also why it can be really frustrating because you're like, just stop doing it. But it's not a conscious, controlled mechanism. So, and then you'll have some where it's all the time, so they'll be doing it in the paddock. They'll be doing it when ridden. They'll be doing it in other situations. And then you have others where it's only in certain situations, like only when you're asking them to trot, or only when, and we have one in our course at the moment, which is only when she's asked to trot under saddle. So it can be that, or it might be they only do it in the paddock, or they only do it at a certain time of the year. Like I noticed with Patch that she would get a little head shake around the canola time, and it was only around that time of the year. So for me, that was purely seasonal. And they say that seasonal head shaking makes up about 59% of cases, and about 41% are non-seasonal. And some of them can be worse with rain, wind, heat, and cold. So, like Mooney also is a bit of a head shaker, but he's a wind sucker and he has a lot of tension around his jaw. And his is definitely made worse with stress. But wind, rain, like heat and cold will also make him worse.
Absolutely. There's a horse that I see, probably only every 3 or 4 months, and he's a head shaker, but the worst his symptoms ever are is during and after body work. He just goes through a little period where it's very prolific, and then there's a distinct improvement for the time afterwards, and the shifting fascia, like there's so much tissue texture change and so many changes throughout his body. It just becomes incredibly prolific for a short period of time.
Yeah, and we'll discuss that a bit with the causes because I have a bit of a theory on that and why, because I've treated a few that were the same, like they were worse during that bodywork session. And so we'll talk a bit more about that with the causes. But some of them also, like they can become worse with like obviously bodywork, so that's an aspect of it. They can become really sensitive to noise and more reactive to noises. My horse used to rub his nose and he'd strike at his nose, And I've also treated some where they want to press their nose into your hand, or one of them, she will press her nose into the ground. And, I think that just gives the nerve some relief. And they say 75% of them will press their nose into things. And then some will snort quite a lot. 64% will snort quite a lot. And then other things that can happen, they can just be distracted. If you imagine just dealing with, well, if you've had nerve pain yourself, we've kind of talked about it a bit before. It's not conducive to learning. It's not conducive to relaxation. It's extremely irritating and unpredictable. And so it can lead to things like rearing, that they'll kind of be eating and then stop eating because of the discomfort. And they can become quite dangerous. If they're really throwing their head around and they whack you with that head, like,
Yeah.
it can really cause a hell of a lot of stress. My horse also, I remember when he was really bad, he would go dip his head in the water trough and then go put his head in the bushes. Like, just trying to get some, and that was just in the paddock. So he was worse at work, but he was showing signs in the paddock and showing like distress, and at times he was quite dull with that as well.
Looking for that stimulation and the pressure on his face and the sensory input, I suppose, to either dull or
Yeah, just
influence
try to
the
change
feeling.
the pain. Yeah,
Yeah.
just trying to change the sensation, trying to seek some way of relieving it.
Coming through. So if you were thinking about causes then, of which there are many, where would you start? Where would be your first port of call or first thought?
Yeah, I think when I was researching this with Jack, I remember reading something that said there was like 150 potential causes of head shaking. And I was like, okay, well that's a lot, but a lot of them are also easy to distinguish. So the first thing to rule out is that there's not a dental issue, because we've heard of like dissections where um you know, the teeth have been looked at, but then they've gone in and found that there was something right up the back where there was a tooth that was like embedding and digging into the gums that was missed by multiple dentists, just because of how far up the back it was. Um, so, dental under sedation and a really, really thorough exam of the horses. So I would advise a dental like specialist for that, like a veterinary, someone who's done extra training in dental work, because you can easily miss a fracture, and you can easily miss stuff that's right up the back. And so potentially x-raying the teeth is another way to rule out any kind of underlying fractures that may not be obvious on the surface. So definitely the number one thing to do is rule out dental disease and rule out any discomfort from like wolf teeth, especially associating with the bit. And just, yeah, having a really good look at jaw comfort. So that would be my number one thing to rule out. The number two thing, well, the next things are kind of, it depends on the circumstances in which it's happening, as to where you're going to go next. So we'll just kind of go through a bit of a list of potential causes and explain what else you might see with that. So allergies. Then with allergies, it's often seasonal or associated with some kind of change in food. So like I have another little horse, he's a Haflinger client's horse, and he's definitely flares up with different foods. He also, which we'll get to, has hind end imbalances. And that's been a chronic problem that we've been managing with him, but he's very sensitive to food. So if you're looking at allergies, you want to keep a bit of a diary so you can start to recognize when it's happening. And then there's specific treatment options that you can definitely do with that, which we're going to go through in part 2. So that's the allergy component. Another one is eye disorders, like just checking the eyes for any cysts or masses that could be, you can get rare things happening with the eyes where you've got things moving around within the eye, or it's affecting vision, or there could be a mass at the back of the eye. Like, they're all pretty rare, but it's really easy to rule out. You can just do it, get a general vet to do a basic eye exam for that. The other ones, I'll just go through the more common ones. So ears. So, we've got teeth, eyes, and ears, and seasonal. So ears, it's rare. I actually have never seen a horse with ear mites or an ear infection, but it's a potential thing to rule out. Or if you live in humid areas, a tick, they could get a tick in the ear. So that would probably require sedation. And so
yeah, definitely. In terms of the ears too, have seen 2 cases where trimming of the ears and hair falling in has been incredibly irritating for horses. So it's worth thinking about. And it was one case being one that I saw where they had trimmed the ears quite a while ago, and so it wasn't really suspected that that would be causing an issue, but the hair falling in there and getting stuck had actually bound in that space, and it wasn't until it was found later. But the person who pulled it out, it was a vet, it was a friend's horse of mine who'd had that happen, said that they had actually seen it a few times. So thinking about the hair falling in there, they usually see it right as it happens, like somebody's trimmed the hair, it falls in, it won't come back out, the horse becomes very irritated quickly. But your ear is so sensitive, and for horses too. I mean, it's such a sensitive area.
And was that a more of a horizontal shake?
It was like tipping water out of the ear.
Yeah. So that it's a bit more, it's less vertical.
Yeah, and it was very ticky, irritating, or like that, but less flicky up, nose
I would
down.
say with ears, there's often a like, you can kind of see a pattern, they're trying to
dislodge
yeah,
something.
like you can kind of tell the way they're holding their head, or they want you to rub their ear, or they've got ear sensitivity. Like, there's usually other signs associated with that kind of ear sensitivity. And I guess, I mean, nowadays the trimming of ears is a bit more regulated, and I don't think they're supposed to trim the whole inside of the ear now. And so when you do it, you can hold the ear in a specific way to make sure that no hair goes in, because we're only trimming the outsides, like, of the ear now with the hair. But they also get wax and stuff in there. Like, I know Jelly, especially when it's summer, he'll get quite a lot of wax in there and want me just to give his ear a good rub. So and so there's ears, eyes, dental, and allergies. Another one is the guttural pouch. So again, this is not super common, but it is a pouch that sits in kind of the back of the throat area. There's a lot of nerves, and also the stylohyoid runs through there of the hyoid. There's a lot of blood vessels in there. And it's a little pouch that kind of opens. It has an opening just in the throat area, and it can become infected. So it can get a fungal infection in there. That's the most common one, guttural pouch mycosis, or some other issue going on. They can get little little plaques and different things that can happen in there. But again, usually with this, you will see other signs. So you can scope them, have a look at their throat. Actually, I just remembered, so another head shaking horse that I've been involved with, they scoped him, and he had a cleft palate, but he was now 7, I think. And they didn't know him as a foal. So he might have had milk coming out of his nose when he was younger, but they didn't expect to find that. But that explains that his head shaking. So basically the soft palate was shorter at the back, and so then it's going to have an impact on how food gets swallowed, and they can breathe it in and have more issues of getting food and water into their lungs. So that going back to the guttural pouch, that wasn't guttural pouch, it was soft palate. But with the guttural pouch, you might see other signs, like they might have a nosebleed, they might have difficulty, funny little swallowing, they could have a respiratory noise, they could have a nasal discharge. They also might extend their head and neck to try to relieve the pressure. They might not be so comfortable eating, and they can have other neurological signs like facial paralysis, like a droopy lip, a droopy ear. So, you know, when we're giving you like however many causes of head shaking, but there's often each
differentiation
other, signs that'll be associated with it.
and things popping up. What are some of the less common things you would see, you know, in head shaking, or less common causes outside of, you know, the big one we're going to get into?
An intranasal mass is probably not that common, you know, so if they've got a mass in there that's causing irritation and pressure, then it might be associated with like a discharge or bleeding, but not necessarily. Also a non-allergic rhinitis. So like, you know how with people, I used to have it actually, like a non-allergic rhinitis. So when I was little, I would sniff all the time. And I have a runny nose all the time. But I didn't have, it wasn't, well, I did have a lot of allergies, but it wasn't all allergies. Like it was, I had a deviated septum, I had a broken nose I didn't know about. And so it was part of that. So I got my septum straightened up, and then it reduced amazingly, and then dealt with the allergies from there. So they can also have like a non-allergic rhinitis, which is an inflammation of the nasal passages that causes a bit of it's often a clear discharge, clear runny nose. The other one would be a nuchal crest avulsion. It's not common, however, I think damage to the nuchal crest is common. Like, you know, we see a lot of remodeling around there on x-rays and things, but actually like pulling it off. So the nuchal crest is at the top of the pole, and the nuchal ligament attaches to it. And so if they've had a bad trauma, say they've ran into something and hyperflexed their head, or they've fallen on their nose, or they've had like a really bad pullback, or they've whacked it on like the float. So if there's a known trauma when the head shaking started, that's really useful information. So if you're like, my horse hit its head on the horse float, and then a week or so later it started head shaking and became pole sensitive, then you're like, okay, you probably should radiograph the head and check for any fractures.
Yeah, absolutely. And yeah, such an important space. All that connection into the back of the neck, like everything from the spinal cord and the fascial connections, you know, there's just so much going on there. And it is so close to that side of the jaw where you've got the trigeminal nerve coming around as well. How about sinus disease or sinus congestion or issues with the sinuses?
Yeah, so I've treated a couple of horses with sinus disease. One in particular, he had this recurring, I think it was a discolored nasal discharge and snorting and irritation. And so I didn't see him at that point. I saw him after he'd had surgery. I think he might have had twice, maybe. So they do like a flap and then flush out the sinuses, and so, but he had it relating to the sinuses, but then post-surgery, like if your horse has to have a sinus surgery, I would highly recommend something like craniosacral therapy post-surgery, because they often do a bone flap, and so you can get a lot of tension associated with healing of that, and potentially, you know, ongoing fascial tension and headaches. So yeah, sinus disease is probably a little more common, but still not super common. But yeah, it's like an ongoing irritation with often yucky discharge.
Absolutely. If you also can, when we're talking about there's so many structures inside the head. You've got like inside the ears, you're talking about like the throat passages, etc. How about, the hyoid and the hyoid connections?
Yeah, I mean, I love the hyoid. So I've seen a horse with tympanohyoid osteoarthropathy, and so his was a bit of a weird presentation because he they found him down, and they don't know why he was down up against a shed, and so they don't know why he was down and why he got stuck down. And then when he got up, he had an obvious kind of signs of a head injury. So the way he was holding his head, the way he was tilting it, his sensitivity. And then they ended up x-raying him, and he had tympanohyoid osteoarthropathy, which is arthritis in the junction of the hyoid to the skull at the base of the ear there. And I mean, that couldn't have occurred. Like, I would say he had that before because of the degree of arthritis that was in that area. But from that point, he had facial nerve paralysis, and so he had a droopy lip, a droopy eye. He couldn't use his tongue properly. It was very painful. And so we did treat him, and we were seeing some great resolution. I actually used a lot of taping and things with him. We saw some great resolution with the facial paralysis. And then the owner decided to do surgery, and so they disarticulated the hyoid at the serratohyoid joint with the stylohyoid, I'm pretty sure, to stop the pressure on the arthritic bit. So basically then means that the stylohyoid is not moving in swallowing. And so then he had to learn to like eat and drink again because the hyoid's really important for swallowing. And so he had to learn how to use his tongue without having a functioning hyoid. So with that, the signs that you might see are sensitivity around the base of the ear, an imbalance in the way that they use their tongue, perhaps pain or really restricted in the movement of the hyoid.
I
They
would imagine tension through the hyoid connections down the neck as well.
Yep, into the base of the lateral sides of the neck. Yeah, and if you put a bit on them, they can resist bit pressure or even just resist flexion, because that can just change put pressure into the base of the hyoid. And that can also be damaged which we're going to talk about but with pullbacks. So a horse that's had a pullback can lead to nuchal crest issues where the nuchal ligament attaches to. It can lead to arthritis in the tympanohyoid joint potentially because that's right where the halter sits. And then we did the podcast with Emma where we talked specifically about pullbacks and the complexities of that area. So that's a fairly high on my list.
Interestingly, we don't actually get to head shaking in that episode.
No,
we're saving it up. There was so much to talk about the influences through the whole body, and then in coming into this, we're about to talk about how the whole body influences, including influences from pullbacks, then comes back to the head and irritates. But I'm just, thinking also about if you just imagine a skull and where the hyoid articulates with the skull itself, like that is just inside where you have the trigeminal nerve wrapping around the backside of the jaw and then coming forward across the face. So it's a very interconnected spot with lots of tiny little fascial connections and so much movement because the jaw opens and closes and the TMJ joint is right there as well.
OA movement, like the upper neck flexion and extension and rotation through the C1, C2 and
yeah. And then of course, if you have a horse that you are not even riding, if you just move them with a halter, you've immediately placed, pressure across the space around the jaw, across the back of, behind the ears and across the pole, and then of course across the nose, and you've got the facial nerves coming down the side of the face, and then
the orbital at the front there as well.
on the front. And if you are using a bridle, then you maybe have, the influence of the cheek piece, and then the throat latch, plus a bit, depending on how much pressure you're using, and then ear pressure. So there's a lot going on there. It's you're going to have an influence on that space and definitely exacerbate things possibly if you have small things going on. In terms of,
Oh, sorry, can I just jump in there? So, because I haven't actually managed to mention the trigeminal nerve specifically, like we've kind of scouted around it a little bit, but one of the things in all the papers that they talk about with head shaking is that it's a trigeminal neuralgia. And basically what that means is that it's a problem or inflammation of that trigeminal nerve, which, as Sophie said, comes out around the back of the jaw, and it's also part of the cranial nerve. So the pole area is really important, and pole function and jaw function is really important for that trigeminal nerve. And so we'll call it trigeminal mediated head shaking, but that's just generally a symptom. So the trigeminal nerve has become really unhappy, really irritated, and they're now showing signs of that being irritated, such as the nose pressing and the head shaking and all those signs. But I believe that the trigeminal nerve has become irritated for a reason. That's not the cause is not the trigeminal nerve. The question is, why is the trigeminal nerve unhappy? Why is it irritated? And yeah, how do we get to that place? Like, is it, an allergic aspect of it where I know when I have hay fever, it's just like, you feel like all your nerves are on fire. So is it like an allergy aspect? Is it
a light sensitivity?
Well, often the light sensitivity also comes with the trigeminal neuralgia. So just the influence with the optic nerve. Yeah, and so you will get horses that are photosensitive, like light sensitive, and that's to me also a symptom. If they're light sensitive, that nerve is being affected, and that could make the head shaking worse, but it's still like, why did they become light sensitive? Like, why is that nerve irritated? And same with the noise sensitivity. Like, to me, that's a symptom as opposed to the cause of the head shaking being noise sensitivity, or the cause of the head shaking being light sensitivity. To me, they're both symptoms of trigeminal sensitivity. Yeah, so that takes us also into, well, what do I think the potential causes are on the trigeminal nerve? And we've talked about all the, some of the causes that can cause irritation around the head, but specifically with the trigeminal nerve, part of the theory, and there's no scientific papers on this, and it's anecdotal evidence from what I've seen in practice, is that, and our understanding also of myofascial lines, which we're going to do some episodes exploring them in more detail, but there's such a interconnectedness of fascia throughout the body. And if you have a problem in one part of the body, it's going to influence the way that whole body functions. And what I've seen now with a few head shakers is hamstring issues, hamstring scarring, hamstring trauma. And so at least 3 specific cases have had obvious hamstring issues. So one had a massive hamstring scar, probably about bigger than a tennis ball she has. And she wasn't head shaking initially. And then one day she ran crazy around the round yard. She just got herself into a tiz. And from that moment on, she started head shaking. And it took us, I can't remember, like over 6 months to get it back under control. And she was one of the ones that, but what made me think about, she was probably the first one that really made me think about this, because what you said before about them getting worse with body work, well, every time I would work on her hamstrings on the scar, she would start head shaking. And so part of her treatment was like working on the hamstring scars and working on the sensitivity and the tension around the jaw and the trigeminal nerve. And it took us a while, but now, I mean, she ran around crazy the other day and her head shaking didn't come back. So we obviously, every now and again, we'll get a little flick, but nothing like it was, the dangerous head shaking. So she was one case that I was like, interesting. And then the other case was a horse that I treated for a hamstring injury. And as a younger horse, and then, I'd see her every now and again, the owner was taking her up workload wise, and so was asking for a lot more collected work. And she said she'd been working really well. And then she just felt a moment that something happened in that moment. And from that moment, she started head shaking. And she again took us, it was nearly 12 months, 6 to 12 months. So with these cases, you need to allow a lot of time. But we rehabbed her entire body through that process. And I'll talk about her in treatment. So she was number 2. And then number 3 is a horse who also has kissing spine, as well as hamstring like scarring and some issues around her right hind hip, I think. And she actually improved a lot. She improved a lot with therapy, like body work, rehab, postural work. There was massive improvement. But then also giving her hyaluronic acid, for some reason, whether it was the arthritis in the spine or the head, she also improved a heap with that as well. So yeah, there are a few of the cases with hind end issues, and then you said with the tubercoxy, and then I was thinking about another horse that I had who had a fractured tubercoxy, who when I first started treating her, like now it would be 7 years ago, she was really sensitive at her pole. And the owner said, oh, like he had trouble getting her halter on and stuff. And I didn't really make that association then because she had tension at the pole, and a couple of treatments, we sorted that out. But the imbalance that she'd had through her whole body from that fractured pelvis and still has, really makes sense with her head and pole sensitivity.
Yeah, there's just so much influence coming through from the hind, and of course that horse that I was speaking of, who'd had who'd injured his tubercoxy, and then his pelvis had become dysfunctional. He had scar tissue, especially through his hamstrings, that got worse at times and better at times. And he, of course, had kissing spines as well. So that's a lot of dorsal line influence, the myofascial connection up into his head. And he also was a pullback horse, that couldn't be put in that position. There was a lot
triple
going.
whammy.
Yeah, exactly. But yeah, and like you said, it's the very long-term full body changes because it reduced over time when in correlation with the rest of his body improving.
Yeah, 100%. And yeah, I mean, we have to really look at that hind end when we've got a head shaker. And specifically if we've ruled out all the other common causes around the head, then we need to look at if there's been a pelvic fracture, if there's been hamstring scarring. Specifically, I think there's an association with hamstring scarring. If there's an imbalance through the pelvis, there's going to be an imbalance through the head. And that can set up a fascial pattern and fascial tension that then creates issues with the trigeminal nerve. Some other things that you would definitely rule out are obviously bridle and bit fit. So you can go and listen to our awesome podcast with Fiona on bit fit. So that you definitely want to rule that out, especially if they're showing it when being ridden. But if you're having issues with the bit, I would then also look at hyoid function. 100%. Like, get a body worker who really knows what they're doing with the hyoid. Saddle fit. You need to rule out compression in the wither area of the accessory nerve, which is a cranial nerve. The saddle might fit okay, but it just might be pressure in certain moments, depending how they're holding their posture. So you want to rule out saddle fit, and then you want to rule out the rider. You know, how they're using their hands, how they're riding, whether they're creating an increased tension through the body of the horse. And the thing that I wouldn't say is that it's behavioral. I really don't believe any head shaking is, well, unless it's associated with stress and anxiety, but that's to me not behavioral. That's associated with stress and anxiety. So it's, yeah, it's still a problem. If a horse is head shaking, you need to investigate it further. And you know, we have the old saying of, well, it's idiopathic. And what that means is we don't know what the cause is. And that's fine, but I'd still say keep investigating because, you know, there's still a cause. It's just that we haven't been able to figure out and we can't diagnose it, or we haven't explored it in the right area diagnostically. There still will be a cause. It can just sometimes be very difficult to find it.
Absolutely. Yeah. And also, if you, I've got one case where somebody was very convinced their horse was head shaking, and they were pulling the bit out of their hands and sort of like motioning the head up in the process and pulling back. But that is very different, you know. And she said that she had new people who had all said, yeah, like I also have that, I have that, I have that. It's very different because and it's useful to have somebody who can differentiate between the two, you know, the horse pulling away, because the instant that she's gone to you know, only that horse had an uncomfortable, you know, jaw, but it certainly wasn't a head shaking in terms of like, I'm actually head shaking. I'm trying very distinctly to get the bit out of your mouth. So it's really important that you have somebody come who can work through lots of different possibilities with you, because it's, you know, there are so many different presentations, like you've just described, so many different things that present quite similarly. And that's what often professionals are for, helping you discern between them. So choosing somebody with qualifications who can be part of your team to decipher that kind of stuff is really important.
Yeah, definitely. So, like, as my takeaways, I would say, well, the number one thing is have a really thorough history. And so keep a diary of when it does and doesn't happen, because that can be so useful. Video it as well, because also you've got a reference point for where you've started and the circumstances that it's occurring in. And then go through a process of elimination. So rule out common things occur commonly. So you rule out the common things. You'll do a thorough dental exam. You might do a scope because they're pretty easy to do. And you know, examining ears, eyes, nose, like they're all pretty simple veterinary procedures. So rule out all the common things first, and then, you know, go down the road of investigating the body with a well-qualified body worker, and don't get pulled into the trap of it's just a behavioral problem. So they're probably my biggest takeaways in terms of like causes and recognition of it. Do you have any other takeaways you'd like to add?
No, I think that was it's a lot to think about, you know, all of those different things. But, you know, part two, going into the diagnostic part and then the treatment, you know, we'll round out why it's so important to think about posture when you're considering it as a condition.
Yeah, 100%. You've got to look at the whole horse for this, specifically the whole horse posture and muscle balance and all of that's really valuable. Awesome. Well, thank you for joining myself, Dr. Raquel Butler and Sophie Vanderberg, in today's podcast. Enjoy your horse time. Please subscribe to the Equine Functional Posture podcast so you don't miss our weekly episodes, and give us a 5-star rating so we can share more valuable insights, and we'll see you in part 2.
See you in the next exciting episode.